All right, so today we're diving into some pretty heavy stuff.
Yeah.
The assassination of the UnitedHealthcare CEO, Brian Thompson,
Yeah.
and all the shockwaves it sent through.
It's been really fascinating to watch this all unfold.
Yeah, and it's not just the murder itself,
Right.
right?
No.
It's the reactions to it
Yeah.
that have everyone talking and really kind of scratching their heads.
What's particularly interesting to me is how this event seems to have just tapped into this wellspring of anger and frustration
Yeah.
that goes way beyond this one incident.
Yeah, and I think you hit the nail on the head there.
Yeah.
I mean, think about it. You've got politicians condemning the violence, which, is expected.
Right, of course.
But they're also acknowledging this deep-seated resentment towards the U.S. healthcare system. It's almost like everyone's tiptoeing around this giant elephant in the room.
Yeah, it's this weird tightrope walk they're trying to do where they have to acknowledge the very real anger,
Yeah, right.
but also obviously condemn the violence.
Right. And one example is Senator Warren.
Oh, yeah.
She said, violence is never the answer, but people can only be pushed so far.
Oh.
This is a warning.
And she later clarified that she wasn't condoning the act.
Right.
But that initial statement, it really kind of speaks volumes, I think, about the level of tension and frustration surrounding healthcare right now.
Yeah, and Senator Sanders had a pretty similar take on it.
Yeah.
He said, the outpouring of anger tells us that millions of people understand that healthcare is a human right. It feels like, this event, this horrible tragedy has become a flashpoint.
Oh, yeah, for sure.
Igniting this debate that's been simmering for years.
It's been brewing for a long time. I mean, healthcare in America has always been this really contentious issue.
For sure.
It's got deep ideological divides and complex economic factors all tangled up together.
Right, and to really try to understand the public's response,
Yeah.
we wanted to go a little bit beyond the headlines.
Yeah, definitely.
And dive into some of these raw and unfiltered discussions that are happening online.
Yeah, let's see what people are really saying.
So we pulled some threads from Reddit.
Oh, boy.
And let me tell you, things get pretty intense pretty quickly.
I bet. So what are people saying? What are some of the themes that are emerging?
Well, one thing that's really striking is how many people are drawing these historical parallels, particularly to the Great Depression.
Oh, wow.
They're pointing to the rise of extremism during that era, as people grew more and more desperate.
Makes sense. I mean, when people are struggling to survive,
Right.
they can become more susceptible to extreme ideologies.
It's almost like they're saying, hey, we've seen this before.
Right.
When people feel abandoned and economically insecure, things can get ugly.
Yeah, and they're drawing a direct line from that historical period to what's happening right now. They're arguing that with the dismantling of social safety nets and the widening gap between the rich and the poor,
Right.
we're creating a similar climate of desperation, and that's a very dangerous thing.
Yeah. And one commenter put it pretty bluntly.
Oh, really? How so?
They said, those who make peaceful revolution impossible will make violent revolution inevitable.
Wow, that's pretty heavy stuff.
Heavy stuff.
That quote is often attributed to JFK, by the way.
Really?
Yeah, and it's a stark reminder of what can happen when, systemic issues are ignored and the needs of the people are just cast aside.
Right. And it's almost like we're seeing this play out in real time now.
It's unsettling, isn't it?
It's scary.
Yeah.
Yeah. And then, there's this whole other side of the online conversation that's a bit darker.
Okay.
A bit more unsettling.
What are you seeing there?
Well, we're seeing comments that are almost celebratory about the CEO's death.
Really?
Yeah. They're laced with this dark humor and a disturbing lack of remorse.
I mean, I get it. Murder is wrong.
Absolutely, full stop.
Full stop.
But I think it's important to try to understand the why behind these reactions.
I agree. I think there's always a reason why people feel the way they do.
Right. So why are some people seemingly okay with this?
Well, while we can't condone violence,
Right.
I think we need to at least acknowledge the sentiment driving it.
Okay.
In this case, it seems to stem from this deep-rooted sense of karmic justice.
You mean like the system is so rigged against the average person
Right.
that some see this act as a form of payback?
Exactly. There's this perception that insurance companies, like UnitedHealthcare in this case, they prioritize profits over people's well-being.
Yeah.
And that CEOs like Thompson, they're ultimately responsible for denying life-saving care.
And when you look at the numbers, it's hard to ignore.
What numbers are you thinking of?
Well, one Reddit user pointed out that UnitedHealthcare made a $12 billion profit in 2021.
Yeah, that's a lot of money.
And that number jumped to $16 billion in 2023.
Oh, wow. Those are staggering numbers.
It's just fuel for that fire.
Right. It fuels that narrative that these companies are just profiting off of people's pain and suffering.
Right.
It's easy to see how someone could look at that,
Yeah.
connect those dots, and feel like the system is just fundamentally unfair.
You know, it's hard not to think about those inscribed shell casings.
Oh, yeah, with the words on them.
Deny, defend, depose,
Especially in there.
and see them as a chilling reflection of the tactics used by insurance companies
Yeah.
to delay or deny claims.
It's, there's a disturbing symmetry there, for sure.
And one of the most powerful comments that we found said, Mangione may face the death penalty for one killing.
Wow.
Thompson and those executives below him are responsible for denying payment for medical care that could have saved lives.
It really highlights that desperation and anger that people are feeling.
It almost reframes the entire conversation, doesn't it?
It does. It forces us to confront this really uncomfortable reality that corporate decisions, particularly within the healthcare system, can have these life or death consequences.
Yeah, and that's what we really want to explore. You know, we want to get into the nitty-gritty of how we got to this point and what we can do about it. So stay with us as we continue this deep dive.
This is important stuff.
Absolutely.
And it's bigger than just, individual CEOs or even individual companies.
Right.
It's about a system that often feels rigged against the average person.
It feels like we're at this point where folks are just questioning the fundamental fairness of it all. Like, are we really all in this together, or is it every person for themselves?
That's a huge question right now, isn't it?
Yeah.
And when people start to lose faith in the systems that are supposed to be there to protect them, they start looking for answers elsewhere.
Which can be dangerous.
It can be very dangerous. It can lead to, dangerous ideologies and extreme solutions. I mean...
Look what happened with Mangione.
Exactly. It's a tragic reminder of how desperation and a sense of powerlessness can really push people to the brink.
Yeah. It's not all doom and gloom, though.
Oh, that's good.
In these Reddit threads, there are a lot of folks talking about solutions.
Okay.
Potential ways to fix the system.
Well, that's good to hear. I mean, it's not enough to just vent and be angry. We have to channel that energy into something constructive.
Right. And some are pointing to these historical examples like the New Deal policies implemented during the Great Depression.
Interesting.
They argue that we need that kind of level of government intervention to address the current crisis.
So for folks who might not be familiar, can you give us a little refresher on what the New Deal was all about?
Sure. So the New Deal was this sweeping set of programs and reforms and was designed to provide, economic relief, financial reform, job creation.
There are a lot of big changes.
Yeah, it's a very complex and often debated period in American history. But there are certainly lessons to be learned from how the government responded to this widespread hardship.
And one specific policy that seems to come up a lot in these discussions is the idea of universal health care.
Oh, yeah.
Like they have in a lot of other developed countries.
Right.
So remind me, what exactly does that look like?
So universal health care or single-payer health care is a system where the government, rather than private insurance companies, pays for most or all of the health care costs.
Got it.
And it's a model that has been proven successful in many countries, providing affordable and accessible care to all citizens.
So essentially everyone's covered.
Right.
Regardless of their employment status or income level.
Exactly.
And that's a pretty radical departure from what we have here in the U.S.
It is. And it's a highly controversial topic here in the U.S.
I can imagine.
There are very strong opinions on both sides.
So break it down for me. What are some of the main arguments for and against universal health care?
Well, opponents of universal health care often cite concerns about government bureaucracy, potential tax increases, and limitations on choice.
So they're worried about government overreach, basically, and higher taxes.
Exactly.
Okay, what about the other side? What are the arguments in favor of universal health care?
Well, supporters argue that it would simplify the system, reduce costs overall,
Okay.
and ensure that everyone
Right.
has access to essential care.
So they see it as a way to create a more equitable and efficient system.
Exactly.
It's a complex issue with no easy answers, but what's clear is that the current system is failing a lot of Americans,
Right.
and the consequences of inaction are becoming increasingly dire.
It feels like we're at this crossroads.
Yeah.
This incident, as tragic as it is, could be a catalyst for real change.
It could be, but it requires a willingness, to
Right.
have these tough conversations, to challenge our assumptions,
Right.
and to consider solutions that might be outside of our comfort zone.
And it requires us to listen to each other,
Yes.
even when we disagree.
We have to be able to understand
Right.
the different perspectives and experiences that shaped, people's views on this.
Yeah, empathy is crucial here.
Absolutely. We need to move beyond the partisan rhetoric and the finger pointing.
Right.
And recognize that we all have a stake in building a healthcare system that works for everyone.
So where do we go from here?
Right. That's the big question.
What can we as individuals do to make a difference?
That's what we need to figure out.
Yeah, it feels like we're just bombarded with information these days,
I know it's a lot.
especially when it comes to something as complicated
Right.
as healthcare. Where do you even begin?
Yeah. To sort through it all. Well, it can definitely be overwhelming, but
Right.
there are some good resources out there,
Right.
reputable news organizations, nonpartisan think tanks, even government websites can sometimes provide some good
yeah.
objective information.
Okay, so beyond just like reading and doing the research, are there ways to actually
Oh, yeah.
make your voice heard?
Absolutely. Contact your elected officials, join advocacy groups,
Right.
attend town hall meeting.
Okay.
Heck, you can even organize
Yeah.
your own community discussions.
It's easy to feel like one person can't make a difference, though,
I get that.
especially with something as big as healthcare.
But remember, every movement starts with individuals speaking up,
Right.
demanding change, and holding those in power accountable.
That's a good point.
Yeah,
This deep dive has been intense.
it has been a lot.
We've gone from a CEO's assassination to the Great Depression.
Yeah, we've covered a lot of ground.
From online forums to these policy debates, it's a lot to process.
It is, but I hope, you come away from this not feeling despair,
Right.
but with a renewed sense of urgency. The challenges are there, they're significant,
Yeah.
but they're not insurmountable.
At the beginning, we talked about those shell casings
Oh, yeah?
inscribed with deny, defend, depose.
It was a chilling message.
Yeah, and it felt like a warning
Yeah.
of sorts.
But maybe we can reframe that.
Okay.
Maybe we can see it as a call to action, a call to reject the status quo,
Okay.
to demand better,
Right.
to fight for a system that actually puts people first.
This whole situation, as tragic as it is, it does feel like a wake-up call,
I think so, too.
a reminder that we can't just sit back and hope that things will magically fix themselves.
We can't be passive anymore.
Yeah.
We have to be active participants in
Yeah.
shaping the future we want.
So what's the one thing you want our listeners to take away from all of this?
I'd say this. Don't underestimate the power of your voice. Engage in thoughtful conversations, stay informed, and advocate for change.
Okay.
This isn't just about healthcare,
Yeah.
it's about the kind of society
Right.
we want to build, one that's just equitable and compassionate.
That's beautifully said.
Thank you.
Well, folks, that's our deep dive for today. It's been heavy, but hopefully it's also been illuminating.
I hope so.
And remember, the conversation doesn't end here. Keep questioning, keep learning, and keep pushing for a better future.
We'll be back next week with another deep dive.
Until then, take care, everybody.